So good afternoon, everybody. Thank you so much for taking the time to attend our Capstone defense. We are Team AFO, Accessible Footwear Options, and we are excited to share our research with you today. Team AFO is comprised of Avery Leung, myself, Lisa Caldana, and Andrew Sedmihradsky. We have had the honor and privilege to have worked with 6 individuals who have provided extensive guidance for this project. Our TRP Supervisors, Dr. Edyta Marcon and Dr. Joseph Ferenbok, our project advisory committee members, Dr. Virginia Wright, Gordon Reuter, and Jaime Winkler, and Krista Brown, our local principal investigator at Ron Joyce Children's Health Center in Hamilton. This project was inspired by Andrew's son, Max, a 13-year-old boy with Duchenne muscular dystrophy. As part of Max's treatment, he was prescribed an ankle-foot orthosis, also known as an AFO. AFOs can be recommended for children with neurological, musculoskeletal conditions and injuries to provide support to the lower limb, prevent soft tissue contractures, and improve the ease of walking. Trying to find a pair of shoes to easily fit with the AFO was an extremely challenging experience for Max and his family. They went to numerous stores, tried on multiple shoes, and in the end settled on a pair of Converse, which they needed to rip the soles out in order to fit. Andrew and Max's experience was not unique to their family. Prior to beginning this research project, we spoke to several healthcare providers and families and learned that shoes suitable for AFOs are expensive, uncomfortable, lack stability and support for ambulation, and are limited in the available options. These 2 quotes help illustrate the challenges experienced by trying to find shoes to accommodate the AFO from our participants. I'm dragging this child in her wheelchair into these different places and nobody's helping me, and she's crying and I'm frazzled, shared by one caregiver. A physiotherapist told us, I've never had a parent that just went to the closest shoe store or the Walmart or whatever and found a couple of pairs that fit and the kid liked. These conversations led us to develop the following problem and need statement that were the foundation for this project. Finding well-fitting, stylish, and comfortable footwear to accommodate AFOs is challenging for many patients. There is a need to improve access to footwear for ambulatory youth between the ages of 6 to 17 who wear an AFO. The research question then became, how can access to appropriate footwear be improved for ambulatory youth aged 6 to 17 who wear an AFO? Our group wanted to identify what design features are important to finding footwear that accommodates AFOs, gather information from caregivers and healthcare providers about their experience with obtaining footwear, and co-design an intervention such as a resource, improve footwear design, assist with funding, or ease of purchasing footwear for youth, caregiver, and healthcare providers to implement at a host site, in this case, Ron Joyce Children's Health Center in Hamilton.
Now moving on to the study methods. The study consisted of 2 main stages. In the first stage, semi-structured interviews were conducted with healthcare providers, caregivers, and youth. In the second stage, a focus group was conducted with caregivers and healthcare providers. A purposeful sampling strategy was used to recruit participants from Ron Joyce. To recruit participants, posters and postcards were displayed and distributed to caregivers in the Ron Joyce Prosthetics and Orthotics Clinic. Additionally, the research team emailed healthcare providers, including physios from Ron Joyce. If interested, participants were screened against the study's eligibility criteria via phone call. Due to challenges experienced at Ron Joyce, participant recruitment was expanded to include community members beyond the host site. First, semi-structured interviews were conducted to gain insights into caregivers' buying practices, important shoe design features, and the types of resources caregivers receive and healthcare providers provide to help find shoes. Additionally, the interview questions served to begin the idea generation process. In the second stage, a focus group was held to verify themes identified in the semi-structured interviews and to hold a co-design session with caregivers and healthcare providers to develop potential interventions. For data analysis, the interview data were analyzed on Quirkos using elements of inductive thematic analysis. A codebook was developed and transcripts were divided evenly amongst team members to be coded. The data were also analyzed with the constant comparative method to identify similarities and differences within and between participant groups. Focus group data were analyzed using the constant comparative method. The transcript was reviewed for the level of agreement, and comparisons were made between individual participants and between participant types.
So now that we've told you about how the study was conducted, we'll now share our results. A total of 11 healthcare providers, 7 caregivers, and 3 youth participated in the semi-structured interviews. 1 other participant withdrew from the study prior to being interviewed. The focus group consisted of 4 healthcare providers and 5 caregivers. No youth were interested in participating or eligible for the focus group, and all participants were female. Healthcare providers represented 3 different practice sites, a Hamilton and Toronto-based pediatric hospital and community-based practices. The interviews varied in length from 15 to 20 minutes for youth and between 25 to 40 minutes for healthcare providers and caregivers, and the focus group lasted 120 minutes. The results section will be divided into 2 parts, and first we'll begin by sharing the results from the semi-structured interviews. During analysis of the semi-structured interviews, 3 main codes were used to categorize key concepts. These were developed into 5 major themes: the AFO, shoe design features, information, buying patterns and footwear selection, and recommendations. The first theme was the AFO, in which there were 3 key findings. First, almost all healthcare providers and caregivers mentioned that the AFO is typically constructed before footwear is selected. Second, all healthcare providers and caregivers agreed that the AFO provides almost all of the support and stability to the foot and ankle. And third, when designing an AFO, several orthotists shared that they consider the size and shape of the AFO, trying to make it as low profile as possible. One orthotist stated, "We try and design the AFO knowing they go in a shoe, but we design them for functionality and then hope we can make a shoe work in the end."
The second theme relates to shoe design features, and shoe brands. This theme was the study's largest, accounting for more than 21% of all codes in the data. This theme can be further separated into 5 sub-themes. It is important to note that in the first 2 sub-themes, there were shoe design features and brands identified, which were not universally liked by all participants, such that they were considered both AFO-friendly and unfavorable. One healthcare provider mentions that an AFO-friendly shoe would just have a way to open the top or the front up as much as possible, and then it would be really nice and wide with depth and a removable insole that's maybe even thicker than a regular insole. Yeah, whether it's zippers or laces or Velcro, or even if it has options, because different kids want different things. Caregivers and healthcare providers also highlighted that running shoes were the most common shoe type to work with AFOs. Within this category, high tops were frequently discussed and received mixed responses. Next, seasonal footwear was consistently identified as a challenge, particularly with all boots. Participants found the greatest challenge was inserting the foot with a brace past the ankle joint. While sandals were also challenging, they were less so compared to boots, as mentioned by several healthcare providers. Next, the ability to easily don and doff a shoe for caregivers and youths was an important consideration. Certain required features in AFOs were identified as negatively impacting the ability to don and doff footwear. However, caregivers also highlighted footwear features that facilitate the donning and doffing of footwear. And lastly, once a shoe is purchased, there are cases where healthcare providers and caregivers need to make modifications to the shoes to accommodate the AFOs. One caregiver shared the following about footwear modifications. "We did have to have our person that does the orthotics. He would have to extend the Velcro because unfortunately, and I'm sure kids struggle today with it, is the Velcro is never long enough for orthotics." From theme 3, information, 4 sub-themes emerged. First, resources provided to caregivers and youth. Several healthcare providers endorsed providing verbal advice and education during appointments, including what to look for in a shoe, recommended shoe models, and potential retailers that may have what they're looking for. Second, several healthcare providers reported that their clinics have sample shoes for youth to try during their fitting appointments, but this can be challenging to keep up to date and can quickly become outdated as shoe companies release new models. Third, several caregivers reported receiving little to no information surrounding footwear selection and purchasing. Many caregivers believe such guidance should be provided by their healthcare providers. And lastly, several healthcare providers mentioned the existence of various parent support groups and networks about AFOs and footwear. However, caregivers highlighted that locating the right group can be a challenge in and of itself. Beyond the benefits a caregiver may reap from these groups, healthcare providers may also benefit by hearing challenges experienced by caregivers and incorporate their feedback into the care they provide. One caregiver mentions with regards to the little information received, once you get the AFOs, you're just kind of on your own.
Within the 4th theme, buying patterns and footwear selection, there were several sub-themes that emerged. There are 3 main places where shoes are obtained: in store, online, and in the clinic. However, in-store purchase is preferred over the online option since it does not lend to trying on shoes, and returning shoes can be challenging. And unfortunately, the option to purchase shoes in clinic is only available in a limited number of clinics. With respect to how shoes are purchased, caregivers either bring their child to multiple shoe stores or leave their child at home and bring the AFO to the store. Caregivers either purchase multiple pairs of shoes in the same size or larger sizes to replace shoes that quickly wear out or to account for their child's growth. For youth that only wear one AFO, they need to purchase 2 pairs of shoes in different sizes. One caregiver shared her experience trying to find shoes. It's trial and error. We go to the store, multiple stores, and it's trying them. That's the only way that I could do it. There was consensus among healthcare providers that families lack awareness of funding options for footwear. Caregivers commented that shoes to accommodate AFOs are more expensive. They will purchase lower cost, lower quality shoes because footwear is regularly replaced. Healthcare providers and caregivers identified several additional barriers to locating footwear, such as caregivers' lack of knowledge about where to find shoes and locate stores that sell what they're looking for, lack of footwear availability, limited sizes, models, and style choices, and the expense of AFO-friendly footwear. One caregiver specifically commented on cost. The reason why we've been going to Walmart is because they seem to wear out quickly. We're trying not to spend a lot of money on them. And one orthotist commented about the lack of funding available for shoes. There's not much help in terms of funding for shoes, which is another issue with kids growing out of shoes multiple times a year.
So a handful of recommendations came up repeatedly during the semi-structured interviews. One was a recommendation for a one-stop shop where a selection of AFO-friendly footwear could be tried on and assessed by a professional, either in clinic with a stock of sample shoes or at a vetted shoe that offers professional fitting services and AFO-friendly shoes. A second recommendation was around an information resource. Healthcare providers and caregivers suggested an updated resource, either paper-based online, that would outline AFO-friendly footwear features, models, brands, and retailers to consider when shopping for footwear. A third recommendation was for funding assistance for families that are replacing shoes more frequently. This assistance is particularly relevant for those on a limited budget or without private insurance. The fourth recommendation was around footwear innovation. The team heard many unfinished but innovative concepts relating to shoe design. One idea described a customizable shoe where the various parts could be ordered separately based on need, preference, and season, while others imagined novel ways of opening, closing, and even expanding the size of the shoe, while others focused on the problem areas of AFO-friendly boots and sandals. And the last recommendation was termed sharing is caring. Healthcare providers expressed interest in closer interdisciplinary collaboration with colleagues both in and out of the clinic, while many caregivers stated they also value knowledge sharing and place a high value on the testimonials and recommendations they receive from one another. And now moving on to the focus groups. The first half of this focus group was used to verify the main themes of shoe design, information, plus footwear selection and buying patterns the team had identified from the semi-structured interviews. High-level summaries of these themes were presented, and participants were asked if they were accurate and representative of their experience and if they had anything to add. Overall, the participants indicated they agreed with the research themes and used the feedback time to provide more details or issues to consider around each theme. In the second half of the focus group, participants were presented with the recommendations that had been gathered from the semi-structured interviews as discussed earlier, plus 3 additional recommendations that were elicited from the group. The group voted anonymously to choose the top 3 based on their perceived feasibility, viability, and sustainability. So in the end, information resource, funding assistance, and footwear innovation emerged as the preferred recommendations, and the remainder of the focus group was divided up to give equal time to brainstorm on each of the top solutions so they could be further developed by the participants. Discussions on an information resource centered mainly on the idea of a website and the challenges of maintaining it. The brainstorming on funding assistance focused on access to support staff such as social workers who could help families navigate funding options and other resources. And during the footwear innovation discussion, participants suggested working with companies who are already innovating in other spaces and trying to bring design features available in other parts of the world to Canada. And so moving on to the discussion, based on the data gathered in the semi-structured interviews in the focus group, the team made the following main observations. So there were discrepancies around the exact role of the shoe among healthcare providers. Some felt the AFO provided all the support to the patient, so the quality of the shoes are not so important, while others discussed the role of a good quality shoe in maximizing the positioning and alignment of the AFO. In terms of shoe design, healthcare providers and caregivers' experiences differ drastically at times. Healthcare providers described high-top shoes as restrictive and difficult to don and doff, while the caregivers interviewed found them to work well with their youth's AFOs. The oft-mentioned Billy shoe was cited favorably numerous times by caregivers, but flagged repeatedly by healthcare providers for thin soles, a lack of a 4-foot rocker, and zippers that wear out quickly and let water into the shoe. A challenge mentioned by many participants was a desire for more information when choosing and buying shoes. Healthcare providers often reported sharing information verbally, but several caregivers stated they received little to no information regarding footwear selection, and some stated they were unsure of when to reach out to their healthcare providers for follow-up care and questions. In terms of buying shoes, a number of financial challenges were widely reported. Caregivers often incurred costs by traveling to the US to take advantage of the better shoe selection there. When suitable shoes are located, caregivers needed to budget so they could purchase multiple pairs at once. Healthcare providers often preferred and at times recommended more expensive, high-quality shoes, while caregivers who frequently needed to replace shoes often opted for more budget-friendly options. And the brainstorming in the focus group around the top 3 recommendations highlighted some of the challenges surrounding implementation. It became apparent that there was still much more to learn and navigate. Participants voiced real concern about who would keep the information resource updated, the extremely long wait times to access social workers to help with funding assistance, and the lack of interest from North American companies related to AFO-friendly footwear innovation. More investigation, consideration, and co-design is needed to help overcome these and other issues if the recommendations are to truly address the needs of the community.
Based on the results of the focus group, the 2 preliminary recommendations generated by the research team for Ron Joyce fall into 2 categories, a short and long-term recommendation. The short-term recommendation involves the development of a standardized resource that compiles existing information about AFOs, footwear, funding options, and their respective applications. This would act as a centralized location for information surrounding AFOs and footwear, reaching many families beyond Ron Joyce who experience similar challenges. In addition, a mechanism would be put in place to maintain the resource and ensure the information provided is accurate and up to date. The long-term recommendation involves footwear innovation, designing a shoe or line of shoes with AFO-friendly features, or improving upon existing features of AFO-friendly footwear options. This can be considered a general recommendation for the industry and may be undertaken by an external group to partner with or lobby shoe companies to design such shoes. This will not only support the various needs of youths with different functional abilities and goals, but will also encourage AFO-wearing adherence in youth who may already struggle with self-esteem and confidence.
So moving on to study challenges and limitations, the most significant challenge faced by the group over the duration of the project were the protracted waiting times for official approval. It took a total of 7 months to obtain the necessary REB approvals and research agreements. Our team also struggled to recruit research participants from our project partner site of Ron Joyce. We needed to expand recruitment to the broader community via social media, email, and an amendment to our REB. Of the 3 participant groups, youth were the most challenging to recruit and elicit information from. In addition, all the youth who were interviewed either declined or were deemed ineligible to be part of the focus group stage. So due to challenges around participant recruitment, our data may not be generalizable to a wider population.
The results of this project and recommendations will be provided to our partner site, Ron Joyce, via report and presentation to their staff. We will submit conference abstracts to share research with the broader healthcare community. And in fact, we were successful in our first application and will be presenting at the Ontario Physiotherapy Association Interaction Conference in March 2024. Finally, we intend to submit manuscripts for journal publication. This project builds a really strong foundation to conduct future research. This includes conducting a second focus group to further develop the recommendations to determine their viability, feasibility, and sustainability in the clinical environment, specifically at Ron Joyce. And once the intervention is implemented, a formal evaluation should be conducted to determine if the desired outcome has been achieved and identify what changes are required. Additionally, research can be expanded to recruit participants outside the Greater Toronto Area to tailor interventions that address the unique needs in other geographic areas for both pediatric and adult populations. On behalf of Team AFO, we would like to extend our sincerest gratitude to all the participants who shared their experience and provided their ideas, to our supervisory and advisory committee for your time and guidance along this capstone journey, to the Ron Joyce team for all their support and help with many aspects of this project. And finally, to our families who supported us through the pursuit of this master's degree, we are extremely grateful and could not have done this without you. Thank you very much.